each one, but just hearing that off the bat, that increase, that has to have an impact.
It certainly has. It's been a challenge. We have just stretched our resources, have hired more nurses to take care of this population because the population has grown so quickly.
And what are some of the biggest difficulties or challenges? Say you have nurses coming in who haven't had experience working with children who are born with this. I expect that this is its own set, and I don't want to say that's more difficult or this, but of course it's more complex.
It is very complex. I found myself when I'm interviewing for new nurses to tell them specifically about this population and let them know what they will be experiencing, and I will walk them around the unit and let them see firsthand what it will be like, and explain that you could possibly have a very challenging shift with a baby that's very upset. So put that in your mind and really think, am I willing to take care of this baby?
Great. Anything else that you would like to add to that point?
And to follow up on Krista's point, I think we also emphasize to the nursing staff and the rest of the hospital staff that these kids have an illness like anyone else that they have to get through. We need to give them kind of loving, unbiased care and treat the parents with respect, because again, we don't delve into all the background on why mom was on the medications or where she got them or what she was told. We're there to try to bond that mother and infant to make sure we can again safely send them home to a good environment.
And Dr. DeVoe, this is another question for you. We have, if an expectant mother needs replacement therapy to help with addiction while pregnant, are there some that are less harmful to the baby than others?
I am not an expert since I don't prescribe during pregnancy, but I think some of the other guests later on will be able to answer that a little bit better.
Okay, wonderful. And now, Krista, I have another question for you. If a baby needs to be hospitalized due to NAS, what is the time range that a baby may spend in the hospital for this?
So we are averaging in our NICU about 17 days as an average. Some babies can stay shorter because they tend to do really well. Others can stay longer. It just depends on how they react to the medication and our treatment that we're giving them.
And are their withdrawal symptoms the same as an adult would be going through?
I don't think so. I don't know.
Yeah, how would that compare, I wonder?
Very similar. Temperature instability, vomiting, sweating, excessive crying. They can have diarrhea. Very, very similar to adult narcotic withdrawal symptoms.
One other thing that we wanted to talk about, and of course under the umbrella of all these different issues, and I think it's especially important now when we have viewers calling in, one of the big things that has kind of made a shift in what you all do is this new legislation. Now, Dr. DeVoe, I'll let you kind of explain the legislation and maybe the pitfalls, potential pitfalls that come with it if there's not enough education.
Actually, there are two pieces of legislation that I should refer to. One is an act that was passed in the previous legislative session called the Safe Harbor Act. And that was designed, and several of us went over to Nashville and testified at committee hearings, to make sure that mothers that needed rehabilitation or rehab treatment or counseling services were put at the top of any waiting list that the behavioral health organizations had in place. Most behavioral health organizations do have waiting lists for regular counseling, but this bill specifically moved them up on any waiting list. So that was a very beneficial piece of legislation.
That's huge.
And I think we'll talk to some of the services here later tonight that might be able to emphasize that as well. The second piece of legislation, which is more controversial, was the one that was passed just in this last session that makes, number one, NAS has been a reportable condition to the health department. But if an infant is delivered and has symptoms of NAS and mother is on a medication, that is automatically reported to Children's Protective Services. And what Children's Protective Services then is they investigate the background. Does mother have a prescription? Was she on any other medications? Is she getting rehabilitation care? And then it's up to Children's Protective Services, working in the best interest of the infant and mother, to make a referral to the DA's office if needed. So not all cases are referred to the DA's office. The Children's Protective Services, which have the resources to do the background investigation, are the ones that make that call. And the DA's office tries to make a decision. Yes, incarceration would be kind of the ultimate choice or ultimate thing that could be done to them, or the most extreme measure, but they want to avoid that as well. So they're really trying to, instead of incarceration or jail time or other penalties, get the moms into appropriate rehab. So it's a kind of a stepwise progression, but we are mandated as providers to go ahead and report to DCS And it's up to them whether to take it the next step or two to the district attorney's offices.
Now, this was very controversial legislation, depending in which line of work that you work with this population. I mean, if you guys don't mind me asking, what were your initial thoughts and possibly concerns about this, even more so? I know that, again, people fall on different lines of this, of whether jail should even be in the equation at any time.
Well, I work with the March of Dimes a lot, both at the state and national level, and they're concerned with any threatened judicial action against these moms as it may drive them away from accessing prenatal care and getting good care during the pregnancy. And again, several of us went over to Nashville this past session and built some safeguards into the measure so that there is a sunset provision. What a sunset provision means is after a certain time period, this law will expire, but it can be continued if we can prove it's a safe law. So it's not a permanent or an indefinite law or piece of legislation. It is has some measures built into it to really see if it's effective and make sure we're not causing something worse than the original problem.
Because this is the first law of its type in the nation, correct? Mm-hmm. And so do you think that is very indicative of what a problem it is in our area, that someone felt that that legislation was needed?
And the state of Virginia is also looking at, they have an identical issue. It's the Appalachian region, not specifically Northeast Tennessee counties.
And so is Virginia looking into similar measures now?
They are setting up, I think, the infrastructure to be able to do that.
And Krista, you had said before the break that you specifically do have a lot of women coming to you that you feel have been given that misinformation. Is there any specific stories that you want to share that maybe some of our viewers can relate to and think, I felt that same way, and that they're not the only ones who may be having some of those fears?
I think the saddest story to hear for me, and I hear it all too often, is that they were told their baby would not come to the NICU, and they're just devastated, absolutely devastated. And like Dr. DeBow had said previously, that feeling of guilt. So it's talking with these moms and telling them it's okay that you are here and in this situation. We are just here to help you and help your baby and provide them the education that they need to go home safe and happy and healthy.
And jumping off of that, I mean, that is what we're here to do tonight, is to help people raise awareness, know that you're not alone, and know that there is no wrong question. So our lines are open right now. Call the number, and we'll be right back after this break.
Niswonger Children's Hospital, just for kids.
Our region is seeing a drastic increase in babies born exposed to drugs. When a pregnant woman takes certain drugs, prescribed or illegally, her unborn baby can develop drug dependency. Babies born dependent on drugs can experience a variety of withdrawal symptoms known as Neonatal Abstinence Syndrome. Niswonger Children's Hospital and WJHL Just for Kids urge you to call or visit the web to find out more about Neonatal Abstinence Syndrome.
Just for kids, because one size doesn't fit all.
Hi, I'm Kylie McGivern with News Channel 11. The number of babies exposed to drugs before they are born is drastically increasing in our region. Exposure to drugs often leads to neonatal abstinence syndrome. Niswonger Children's Hospital and WJHL are working to provide hope, support, and education to drug-dependent mothers. Don't let the shame of drug addiction keep you from getting the help that you and your baby need to start a healthier life together. All you have to do is visit WJHL.com/justforkids in your corner for information.
Niswonger Children's Hospital, just for kids.
Even a supervised drug replacement therapy program can affect a woman's unborn child. The baby may be born dependent on the drug and experience neonatal abstinence syndrome. If you're pregnant and taking methadone, Suboxone, or Subutex, find out the facts about the health of your baby.
Niswonger Children's Hospital and WJHL Just for Kids urge you to call or visit the web to find out more about Neonatal Abstinence Syndrome.
Just for kids, because one size doesn't fit all.
Hi, I'm Kylie McGivern with News Channel 11. Babies born with neonatal abstinence syndrome are exposed to narcotics or other drugs that their mothers took while pregnant. NAS occurs when the baby withdraws from these drugs. Symptoms can include irritability, continuous crying, tremors, poor feeding, and sleep problems. These babies often need medical care in a neonatal intensive care unit and require more time and patience to soothe at home. Just visit WJHL.com/justforkids in your corner for more information.
Niswonger Children's Hospital, just for kids.
Babies withdrawing from drug dependency, also known as Neonatal Abstinence Syndrome or NAS, is a growing issue in our region. If you've used prescription opioids or street drugs, ask your healthcare provider about long-acting birth control. Prevent an unintended pregnancy and a baby who could experience NAS.
Niswonger Children's Hospital and WJHL Just for Kids urge you to call or visit the web to find out more about neonatal abstinence syndrome.
Just for kids, because one size doesn't fit all.
Welcome back, and thanks so much for joining us tonight for this special Just for Kids presentation. I'm Kylie McGivern. Now, we've been answering your questions in this first half hour on neonatal abstinence syndrome and drug-exposed newborns. Keep calling in with your questions. That number again is 1-888-903-9545, and we'll get to as many as we can until 8 o'clock tonight. I'm joined now by a new panel of health experts. We have Dr. Stephen Lloyd, Dr. Cynthia Thomas sticking with us, and Lisa Tipton with the organization Families Free. Thank you all so much for joining us. And one of the points that we wanted to get to, I know you said we cannot miss this, is the biggest question that we haven't gotten to, prevention. How can people prevent even having to ask some of these questions or having to concern themselves with this really heartbreaking issue?
Sure. Well, I think it's critical to remember that although we can anticipate and manage neonatal abstinence syndrome if it occurs following delivery, it's completely preventable. And so if we think about the best way to approach prevention, really it's educating all reproductive age women about the importance of family planning and preventing an unintended pregnancy. Because if women are exposed to any potentially harmful substance, and certainly a substance that can cause dependence, we want to prevent that unintended pregnancy and prevent the eventuality of an infant being born that could potentially have NAS. So there's a variety of methods that can accomplish that end. Obviously, if a woman has had children and is sure that she's ready to no longer have any more children, tubal ligation or another means of sterilization is an option. However, for women who may want to have fertility later on down the road, long-acting reversible contraception is a great option. And so we want to make sure that all women have access to family planning resources and know that all family planning services are available at all of our health departments, every county across the state.
Thank you so much. And Lisa, I have to ask you now, I know that Families Free, you all are involved with a grant recently that really has been doing a lot to raise awareness about birth control and that as part of a potential end to this problem. Talk about that for us and let people know what is unique about this grant for you all.
Well, what's unique about this grant for us is it allows us to bring together the work that we do with substance abuse treatment and the families that we work with Department of Children's Services. So we have gone out and visited several prescribers in our area and just strongly encourage them to require the women that they are treating to be on a contraceptive and at the very least to counsel them on the negative effects of a pregnancy if they are on medically assisted treatment, and to just take care of their patients well by encouraging them to take care of themselves. And then what we do is we receive referrals from Department of Children's Services, and we often do the intakes right in the NICU. We go up and meet with the moms as soon as they deliver these babies when they are ready to make some changes in their lives, and we try to help them learn how to be mamas that can take care of their babies.
And when you went around to these different providers, what was their response as you were asking them some of these questions or talking to them about birth control? I know that can be a controversial topic in and of itself.
It was, and they were open to the idea. They were open to putting out some pamphlets. Dr. Thomas then followed up with them and provided some more education of how women could access services at the health department. And they said that they would really like to see women be on the birth control.
And some of these providers, Dr. Lloyd, are dealing with medication-assisted treatment, Subutex, Suboxone, and I know that you have a lot of work with that, and a lot of the questions that we have been getting, I know we addressed this briefly earlier, but have to do with a lot of women who feel like they're being blindsided. When they go to the hospital, they deliver their child, they were told the baby will not end up in the NICU, and they do. So how do you want to respond to that?
Well, respond to it first of all by telling you that there's no magic bullet. There's no medication that we can give an opiate-dependent woman who is pregnant that will prevent her baby from being born with neonatal abstinence syndrome, and that's what I lead with every pregnant woman that I get. We have to look at the goals of treatment, and the goals of treatment are to have a live baby, first of all. The baby can die from mom withdrawing. Mom won't die, but the baby can. So the goal, first of all, is to keep mom comfortable